alkaline fluid whose function is to enhance sperm motility. Just like I said about any gland that we talk about here, they all contribute to the volume of the semen. Also the prostate gland doing that. Prostate cancer. Okay. Now, prostate cancer, we have to know that prostate cancer is actually it's the third most common cancer in males. The way that prostate cancer is diagnosed is through a digital rectal exam where the physician palpates an enlarged prostate. The most common symptoms, sometimes you see slowed urination and or frequent urination. If a physician detects a enlarged prostate, the next thing that the physician orders is a blood test for the prostate specific antigen known as the PSA. When the PSA is high, usually in the 70s or in the 80s level, this should help you to suspect that there's some type of either inflammation is happening, called prostatitis, or enlargement, benign prostatic hypertrophy or hyperplasia. Or it could be as a result of prostate cancer. Okay. However, keep in mind that sometimes PSA is not elevated in all types of prostate cancers. The function of PSA is to liquefy the ejaculate. So we take a biopsy of the prostate to make sure and confirm the diagnosis. Next thing, we have the bulbourethral glands, also called Copper's glands. They lie inferior to the prostate gland. Their function is to secrete a mucus-like fluid. This fluid is actually released in response to sexual stimulation, and its function is to lubricate the end of the penis. So semen, okay? So the fluid, the urethra, conveys to the outside of the male body during ejaculation. It will contain, so semen contains sperm plus the secretions that we got from all the accessory reproductive glands that we just discussed, which includes the following. It will contain sperm cells that came from the testes. It will contain these secretions from the seminal gland, prostate glands, and bulbourethral gland. Semen is slightly alkaline with a 7.5 pH. It also has nutrients and prostaglandins. Okay. Okay. Male infertility. It means that inability of sperm cells to fertilize an oocyte that after trying for 1 year, consecutively. Different causes include cryptorchidism, which is the failure of the testes to descend, inflammation of the testes caused by a virus disease like mumps, poor quality sperm, abnormal head, or an abnormal acrosomal reaction, and low sperm count, usually less than 20 million per milliliter of ejaculate.